Hello, welcome. Let me introduce myself a little bit. My name is Chung. I'm the professor in the Faculty of Medicine. So actually, I have different positions in the faculty. Number one, I'm the Assistant Dean for Admission in the faculty. So not just the global health, if you have interest in Chinese medicine, nursing, biomedical science, MBBS, okay, you can let me know. Okay, afterwards. Okay, in the coming half an hour, let us focus on the global health and development. Okay, so this is something quite new. Before we continue, can I ask you something? Do you know what is the difference between clinical health, public health, and global health? So clinical health, clinical medicine, just like a doctor, a nurse, their job is very noble, right? They are saving life. Okay, heart disease, cancer, they're saving people one at a time. We do the resuscitation. We save people's life one at a time. But how about public health? We are saving life 1 billion at a time. Why? A very good policy against the COVID. Okay, a very good tobacco control policy that can save life 1 million at a time. I'm not saying that we are more noble than the clinicians. It's just that we serve in different platforms to help this world. Okay, global health is an extension of the public health. If the issues are related to the global level, then we call it global health. For example, the climate change, things like that. Oh, by the way, another question for prospective students. Can you give me some example of global health? COVID, yes. HIV, yes. Okay, influenza, yes. Monkeypox, what else? AIDS, what's that? The full name? Okay, well, we have mentioned a lot of the infectious diseases, but actually, global health is much more than that. Say, for example, poverty reduction, reduce hunger, improve the education, or the things happen in Gaza, in Ukraine, right? They are at war. They are at war, but we need to provide a lot of humanitarian crisis relief actions. And after the war, we have to rebuild the whole community. So global health is not just infectious diseases, okay? So you may wonder, okay, this global health and development is under the Faculty of Medicine. Why we classify ourselves as Bachelor of Arts and Sciences? 第一係咪啊？ Oh, Bachelor of Arts and Bachelor of Science. Okay, okay. Why? Say, for example, COVID, 新冠, right? The development of the vaccine, very scientific. Okay, in the laboratory, the pharmacists, the scientists, okay, it's very science. Okay, but for our subject, we are not going to ask you to develop our vaccines. But once our vaccine is available, how can you convince the people? This is safe, okay, not much side effect. This is psychology, right? It's not just about the science. Once you have the vaccine, whether the community, the people want to take it or not, this is more than science. So it's something related to social science, right? Another example is, do you still remember what is CAP 599? 599. If you do not get the vaccine, you cannot go to cinema. You cannot go to school. Oh, good. Do not need to go to school. Okay, I'm just kidding. So CAP 599, no. Public health, global health, a lot of things is related to the legal framework. So that's why if you want to study global health and development, you need to know a little bit about the law. How about the architecture? Oh, why we need to know about the architecture? You need to know about the architecture as well. Architect, 建築, why? Okay, the government always encourage the young people to do more sports. Okay, improve health. But the urban planning is no good. How we can encourage the students, the citizens to do more sports. Okay, this is urban planning. In the global level, in Gaza, they are at war. One day, the war will be over, and we have to rebuild the whole community. Safe water supply, sewage, all these things, they are public health and global health. And you need some kind of urban planning architecture knowledge. So that's why we need our students to study not just about the science, but also the arts in relation to business, economics, social science, architecture, etc., etc. Okay, so that's what we mean by interdisciplinary approach in the curriculum development. Okay, so that's why, although this is under the Faculty of Medicine, most of the sections will be taking place in the main campus. And this is a good news for many young people because it's close to the MTR station. You don't need to go to a primary hospital, and you can just go to all the restaurants in the Kennedy town. Okay. In South Africa, we do have some good choices like the Pizza Express, like the Subway, things like that. Okay. Anyway, so most of the classes will be taken in the main campus. Is it good news or bad news? Of course, we have some rooms for the student society, for the global health students, so that they can stay in the medical campus as necessary. So you see architecture, economics, law, public health, science, and social science. Okay, so you may wonder what kind of subjects you need to study in your high school. For example, if you want to study MBBS or Chinese medicine, you have to study, for example, chemistry is a must. But for the global health and development, we have no preferred or compulsory subjects for your high schools. Okay, if you do not study biology, chemistry, geography, economics, it's okay. It's okay. Because we have already some subjects that we want you to have taken in the year one. So that's why, okay, if you don't know about biology, chemistry, economics well, in the year one to foundation course, we will equip you with the fundamental knowledge. And then in the year 2 and year 3, you know, in the university level, you have a lot of freedom. You can take quite a number of the elective courses. If you want to know more about the finance aspect, or you want to know more about the psychology aspect, or you want to know more about the health policy analysis, health promotion, you can equip yourself more in the direction you want to go in your year 2 and 3. Okay, and in your final year, one very unique feature of this program is the 6-month placement. You know the 6-month placement, right? Okay, so we call ourselves global. Of course, well, actually, I'm the minority. I'm the double minority in this program. One of the things is that, okay, I'm Chinese. I'm local. I'm Hong Kong Chinese. Most of the other skeleton teachers in this program, they are from Australia, okay, Myanmar, United States, this different part of the world. Okay, so this is really global, but we want to make it more global by sending our students to have 6-month placement. In your final year, you have to go to placement for 6 months. Otherwise, you cannot graduate. It's a credit-bearing course. And in a couple of minutes, our placement coordinator, Dr. Andrew Park, will elaborate to you more about this placement program. And we spend a lot of efforts to make this connection. You see, you just go to the other undergraduate briefing. Okay, not many programs can guarantee you to have the placement opportunity. For example, in the United Nations in New York, or Red Cross Head Office in Geneva, China CDC, MSF, 無國界醫生, things like that. Okay, we'll talk about it later. And I always mention that this 6-month placement is very important for your future, because some of the parents, okay, may already want to raise the question, what are they going to do after they graduate? I didn't know that, okay, in the government, we have a position called Global Health Officer. No, in the Hong Kong government, they do not have a job called Global Health Officer. But in the government, they do have jobs like Information Officer, Executive Officer, Administrative Officer. And actually, we have 2 cohorts of graduates. Some of our graduates, they are now working in the Health Bureau. Okay, in the Health Bureau, the Primary Care Office, 醫務衛生局, as well as the Social Welfare Department, things like that. And not to mention that, okay, this 6-month placement will be some of the best job interview opportunity for you. You are going to stay with your potential employers for 6 months, and quite a number of our students, they did get return offer after the 6-month placement, both in Hong Kong and in overseas. Okay, so this 6-month placement is very, very important. Okay, so well, just scan through these attributes that employers are looking for. Okay. Project management, stress management, motivation, blah, 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 etc., etc. Okay. You can see quite a number of them, they are not that theoretical. So that's why in your year one, it's a must for you to take some compulsory courses because you are from different background. Okay, you may study geography in your high school, you may study biology, okay, you are doing IB or you have done the DSE. Okay, so that in year one, we want to do some catch up for everyone so that they have some fundamental knowledge in different parts of the areas in the public health. And then in the year 2 and year 3, through different courses as well as the teaching mode, case study, problem-based, etc., etc. And then in year 4, you can have a 6-month placement so that you can equip yourself. You know how this world is working. Okay, so perhaps I should stop at this moment because I'm too 長氣 and lengthy. I should leave more time to our superstar, Dr. Andrew Park, because he is the mastermind for the placement. Okay, don't ask me, I want to go to WHO, things like that. Ask him. Okay, thank you very much.
Thank you very much, Professor Chung. I don't know if superstar is appropriate, but I am the placement coordinator, and it is my pleasure to give you an introduction, a little bit more information about what we do think is a really integral part of the program and actually literally forms the capstone of your studies if you become a GHD student. The field placement, just a general introduction, what it's really about is putting into practice all of those things you've learned in the first 3 years of the program in a meaningful way in the field somewhere, actually operationalizing your knowledge. It takes place at the end of your 3rd year and the start of your 4th year. So you've got the first 3 years of your degree, you have a lot of knowledge, you have a lot of ideas, and now is the chance to put them into practice. I'm going to go through a number of the sites a bit later as well, but just adding on to what Professor Chung said, we've got some pretty exciting names, especially for undergraduates. Things like UNICEF, UNDP, these big UN agencies, it's not very common that they take undergraduate students. If you normally apply, it can be quite difficult. Usually they're looking for master's level students. We have agreements with them, as well as the IFRC, which is the International Federation of the Red Cross, and a number of NGOs and governmental organizations, including the Chinese Center for Disease Control, and so on. And I'll give you a little bit of a taste, just a moment. As I said, it takes place at the end of your 3rd year. It's also something which the program facilitates. So we don't just say, you have to go on an internship placement for 6 months, goodbye, off you go. We try and help you get to these places. We help match you to these places. We also allow students, if you have a really passionate idea for an organization, which we don't know about, we're very willing to listen and try and help you achieve that, help you open up that door and go to that location. But we have our own partner sites, which would say 80% of students go through us and we match them to various sites. The matching process is actually going on now for the current 3rd year students for their placement next year. I won't go into that very boring details, but basically it looks like the JUPAS procedure. You put your kind of A preference, B preference, and C preference, and all this kind of thing. But the aim is to get students into places where they're a good fit and where they'll benefit the most from this placement experience. This is just a little taste of some of the images of what you might be doing. You can see, for example, at the top left, this is a big UN conference. I think this was a conference on water conservation. And we have a number of students every year who go to the United Nations headquarters in New York, working for United Nations Development Program or the United Nations Children's Fund, UNICEF. And they're actually there during this big meeting in September. You've heard of the UN General Assembly. All the countries in the world meet in September. And we have our students there helping out organize these big meetings. one component of the placement, as Professor Chung said, it's a credit-bearing component. So you're still a part of the school. You have to write monthly reports about what you're doing. And yes, I get to read them. And actually, it's quite interesting because I get to see through our students' eyes what they're doing. And you get some very exciting reports, people taking part in high-level meetings, people, meeting some, pretty prominent diplomats and statesmen around the world. That's a pretty exciting thing to happen in your fourth year as an undergraduate. We can also, what can I show? On the left, we've got some examples of the more private sector type of placement. So it's not just a UN site. Global health is a broad spectrum. So it also includes things like the private sector, and there's an organization called Amarex in Taiwan, and we've had students go there. They're trying to basically think about regulations for pharmaceuticals. How do you get your new drug onto the market? And that's an organization which is working with the American Food and Drug Association to kind of get new pharmaceuticals registered. So we have a broad range of placement sites. It's not just UN, it's not just humanitarian organizations, it's a really broad spectrum of placement sites and therefore job opportunities that you're setting yourself up. A few other images here just to give you a taste. I mentioned humanitarian work. This is, of course, something that a lot of students are drawn to when they join the program, after the program as well. One of the key things of global health and development is, of course, the last part of that, the development. It's really important in a global sense to improve the development standard, the living standard across the world. That is the best way to improve livelihoods. And we've got students really at the cutting edge of that. So we've got some at the top. You will see some images from a student last year. Actually, we have a student this year as well, who went to Sao Tome and Principe. Raise your hand if you know where Sao Tome and Principe is. Professor Chung knows, that's good. Somewhere in the Caribbean? Not quite. The somewhere is correct. So if you go from the Caribbean, across the Atlantic, it's on the west coast of Africa. It's a little island, one of the poorest islands, poorest countries in the planet, but also a really charming place with very happy, nice people, but just very low development standards. And we had students going there with the United Nations Development Program, doing some basic things, looking at field hospitals there, joining meetings of local UNDP staff, local medical people, working really at the grassroots level to improve health systems. So that's something quite remarkable, something quite interesting to be doing as an undergraduate. Then we have the pictures down here. This is one of our graduates now who had her placement in the GX Foundation. Has anyone heard of the GX Foundation? GX Foundation actually is a Hong Kong-based philanthropy, but their main thing is they organize surgeries, eye surgeries, cataract surgeries in Southeast Asia, also in Africa. So you basically arrange a team of doctors and they operate on your eyes and they give the gift of vision to thousands of people. And this is one of our students who went to Cambodia with them, and Laos and Cambodia, helping organize these big surgeries, helping organize this big, large-scale philanthropic effort. So again, a pretty important, a pretty interesting experience to be doing as an undergraduate level. I gave you some of the pictures to showcase some of the experiences. This is our map. I believe this is our current map. It gets a little bit tricky now to see because we're actually on our third cohort is currently on their placement. So it usually runs from about June to December in your end of your third year to your fourth year. So we've still got our current students are on their placements. But if you look at this map, you can see the broad spread of places that we actually have. I like to think that, in a sense, GHD is taking over the world. Part of what I enjoy is setting up new placement sites in different countries. So we're trying to expand. We don't have South America yet, but I'm hoping to work on that. We don't really have too much in Africa, but we've got Sao Tome. The aim of our program is really to have placement opportunities all over the world. You can see we've got United States, we've got Europe, Turkey, Pakistan, and India, mainland China, Southeast Asia, Indonesia, a lot of options in Hong Kong if you wish to stay here. Although, as Professor Chung said, we really aim and hope students take this as an international opportunity to go abroad somewhere. You get the full spectrum of what we're doing here. You can do opportunities with UN agencies, NGOs, research organizations as well, if you're more into the research side of things. So what we really want to do is tailor the placement to you so that you get the most out of it and the partner site gets the most out of it. There's no point for us sending somewhere to a placement site where they don't want to be. That's not very helpful. The aim is to really fulfill something that is meaningful for the students. So we've got WHO is one placement site we haven't quite managed to get, but the school actually has a connection to WHO. So if you're interested in a partnership with WHO, you can actually do this from the School of Public Health in Hong Kong. We have a number of students who do research attachments in the school as well before their placement, if that's something that interests them. I've been talking a lot about the placement, but we also have, think it's more meaningful to have the students explain their stories as well. And if you haven't been to the School of Public Health GHD program blog, now is your chance to do so. You can scan this little thing, and we have our students write up their own experiences in their own words, telling us what they're doing, what is the valuable work that they're doing, and not just the valuable work, but the whole range of experiences that goes along with it. Because the placement is not just sitting in an office 9 to 5 working, but if you're going to some really new and unique places, you're learning about the culture, you're learning about intercultural communication, you're learning all of these soft skills, which Professor Chung showed earlier on this, what employers look for, are actually very important. If you're an employer, it's really important that you're able to have this kind of capability to communicate, to connect with others, to empathize, to understand other viewpoints. That's really what the placement is all about. These are some of our recent student stories from 2024, also earlier 2022. Skylar was at the International Federation of the Red Cross in Geneva. That's where you have some high-level meetings, you're helping organize Red Cross meetings. Kelvin on the right side there was also at the Red Cross. He is one of our students who went on afterwards to do MBBS. So I'm leading now into the discussion of careers because the placement is very much tied to your career, as Professor Chung mentioned. The placement is a good chance for you to kind of get your foot in the door of perhaps the career you want or position you for further study. It could be that a lot of you, and I think it's quite fair, don't quite know what you want to do. Even if, you get into the degree program you want, you're still not sure because you're at the starting point of your careers. Part of the placement, part of this GHD program is to help you think about what type of careers you want, to help you give you that, foot in the door and the helping hand on your careers. So, speaking of career prospects, as Professor Chung mentioned, a lot of the parents in the room, this is the thing that they're most interested in. They're most interested in, okay, great, 4 years of interesting studies. What is my child going to do? And it seems not very clear from GHD compared to, say, business analytics or, marketing, something like this, or accounting. Okay, you study accounting for 4 years, you become an accountant. It's very clear. With global health and development, it obviously is not quite as clear, but I would argue gives you more opportunities. You have a real potential to go into many directions as you see fit. In your second year, you will declare a minor and a major, and so you can kind of tailor your studies towards different directions. The GHD program gives you a very good position from which to do a lot of potential jobs. So analyst is a kind of job you might get in consultancies and government as well. You can be basically reviewing a country's health system, reviewing a specific health policy, providing feedback on these kind of things, which, as Professor Chung mentioned, these are policies which might affect millions of people. So you could have a real impact in these kind of jobs. You can, of course, be involved in project management. As I said, we've got a number of students in humanitarian organizations as project managers now, as project officers, leading small teams who are making a difference to people on the ground. In terms of particular positions, there's always big international organizations. Professor Chung mentioned government offices in Hong Kong, but there's NGOs, humanitarian organizations, research organizations. We've had our first 2 cohorts of graduates engage in all of these things. In fact, we have one graduate who works at a pharmaceutical company, one who works at a bank, 2 executive officers, a number working in humanitarian organizations, one is a teacher. There is a really broad spectrum. So this is a program which can help you basically achieve the career that you want. I won't go into too much detail, but this is a kind of general view of what some of the career prospects are, and including kind of average salary here. But this is the rundown of some of our previous graduates. I think the first 2 cohorts of graduates, and you can see that we've got a range. As I said, there's a group of students in kind of business, commerce, and industry side of things. We've also got the kind of more humanitarian, commercial, social services there. This includes some prominent organizations like MSF, Doctors Without Borders, also analysts at UNHCR, a number of other organizations. And then, of course, there's the option of further studies. This program is very good if you want to then go on and do a master's because you have kind of flexibility. You've studied a bit of epidemiology, a bit of statistics, a bit of international relations, a bit of economics. So you can use this to refine where you want to study further. And we have a number of students who've gone on to some pretty great universities, London School of Economics, for example, University of Toronto. They've done a number of master's programs, which I think is a really great achievement. So that's the kind of statistical rundown of our student graduates. I won't go into this too much because you've got it all in your little orange booklet, but these are some of the, the testimonies, the statements by some of our alumni. Feel free to scan the QR code to get some more information as well. Okay. Last but not least, turning back to the kind of present. So you've looked at the career prospects. What is life actually like for a student? What is life like if you're a GHD student or a Hong Kong University student? Well, this is now the brief time to discuss, what it's like. You have an opportunity to live in a hall. There's student dormitories, student halls, which have some great experiences. Professor Chung was St. John's, I think, so he can tell you lots and lots about this. I myself went to the graduate house for graduate students at Hong Kong University. Slightly different, pretty boring vibe, but definitely the university hall life is very vibrant. A lot of students join. But there's also clubs and activities and all kinds of sports and so on. The social aspect of HKU is very important because the friends you make at university are the ones that actually 10, 20, 30 years later, you're going to still be in touch with. And they're the ones who you can rely on and maybe give you tips about potential jobs and so on. If you don't believe me, just a few days ago, I had a friend in town from my undergraduate days 20 years before. So, you still keep in touch and it's a really great thing. Make the most of it, engage with various clubs, various societies. One society in particular I can mention is the Global Health and Development Society. So I think we have some members of it here, some of our student helpers or previous leaders of this as well. this is a society where our students are very passionate about promoting global health, promoting global development. They set up a student society, they run activities, all kinds of networking events as well. So really, a lot of activities you should be involved in. The campus life is very vibrant. And as was mentioned, most of your studies are on the main campus. So you've got a main campus feeling. At the same time, you go frequently to the medical campus because we are based in the School of Public Health. And so you've got kind of best of both worlds. And that's quite exciting, getting a taste of all of the HKU life. All right. Now, for those practically minded people thinking about, great, sounds fantastic, but how do I get in? Now, let's turn to admissions. I will admit that this is my weakest part of this presentation because I'm not the best at this, but we have Roger, an expert on these, and I might turn to him in a moment as well. But basically, if you're applying with the DSE, these are the kind of prerequisites here. Level 4 English will be required to take some more additional credits. But the key thing I want to stress is that you are welcome from all disciplines of your high school studies. So we don't just say, oh, we really want science and biology students. We really want arts. And we want students from all backgrounds. Because we are the BASc, the Bachelor of Arts and Sciences, we really value having a nice mix of students from different backgrounds. So that is something we really want. Of course, preferences are given to candidates in Band A when you put choices 1 to 3 in the JUPAS system. And after that, we have interviews, of course. And interviews take place normally in June and July of next year. And that interview is also a great chance for students to ask us questions about the program and for us to kind of get to know prospective students. If you have any questions, specific questions, we'll have a Q&A shortly as well. There is a bonus point system. I won't dwell on this too much. Maybe we can leave that for the question system as well. Again, I'm not really that familiar with the university entrance requirement waiver. This kind of information we will leave to a question and answer. Maybe Roger can handle that in just a moment. I do want to point out some scholarships, though. So we do have some scholarships to encourage and support those applicants. There is the BASc entrance, GHD entrance scholarship. This is only available to local candidates, and there's up to 6 places, about a value of 10,000 Hong Kong dollars each. We know that this is not a huge amount of money. It's not going to pay everything in your studies. It's more like a recognition and a token that we really value this particular student. We really want you to come. So this scholarship is to encourage you for entering the program. There's also the Medical Dean's Scholarship. You don't have to apply for this. You're automatically kind of eligible. And that's up to 15,000 each. These are entrance scholarships. I should also say that there's a number of other HKU scholarships that you can apply for during the years. And in particular, the placement as well has a range of financial scholarships from our GHD program and from the faculty level that students can apply for. In the past cohort, we've had over maybe almost 2/3 of students got some kind of scholarship to support them on the placement. So there's a number of scholarship opportunities. It's not just limited to this, but this is the entrance kind of scholarship system. And finally, there's, of course, a barrage of QR codes. We've got our website, our Instagram. Please do scan this. Please do feel free to send us an email.
I just come to say hello to all of you and welcome all of you to, well, here is not the medical campus, but the University of Hong Kong, all right? But of course, the program that we are describing or we are telling you about is actually from the Faculty of Medicine. Our campus is a few kilometers away down in Southern Road. And I've been quite busy over there today because our faculty actually runs a few undergraduate programs in medicine, nursing, Chinese medicine, pharmacy, biomedical sciences, etc. But this BASc Global Health Development Program is one of our newer and also very successful program. In fact, I'm sure Dr. Chung and Dr. Park have already explained to you, why we wanted to run this program. I've been telling other parents or prospective students in the medical campus earlier on that, in fact, medicine and health, honestly, is a lot more than just about a doctor. I'm a doctor myself, or a doctor working with a nurse, or a doctor working with the nurse and the pharmacist, or a doctor actually, having the support from our scientists in the laboratories, etc. We also need people to actually have a global look and global perspective of health. So global health development is very, very important. I don't intend or pretend to be a public health or global health person, but just perhaps by way of introduction, I am a clinician and I'm a rheumatologist. I'm a so-called specialist. So I specialize in rheumatic diseases or immune diseases. The more, to be honest, I specialize in rheumatic and immune diseases, the more I realize that, yes, it's very important to understand the molecule of a cell and how it has gone wrong and how we could correct it, etc. But we should actually sometimes retreat from the whole situation, move up, and then find out exactly what causes these rheumatic diseases. There are many environmental factors that actually influence the manner we develop these conditions. So I've been also telling people that if I had the second career, I will do one of two different things. One is actually, if I were to become a doctor again, I will become a family doctor, a primary healthcare physician. I believe actually primary prevention is a lot more important. Don't wait until the person has developed cancer or the condition that I manage before you offer help to them. You should prevent it. In fact, if you take one more step backwards, if I were to do it again, I will actually do public health. I will do global health. And so much that, in fact, only 2 weeks ago, I actually went to Berlin with Dr. Park and also the director of the School of Public Health to this World Health Summit to learn about the perspective of, everything else besides what happens in the clinic or in the hospital that can influence health, that could help us improve health. And this is why we believe this program is very important. So this is only the first step, okay, for all of you. A first degree in global health development. Our School of Public Health also run other taught postgraduate programs as well. Health is economy. Good health means good economy. Good health starts from global prevention. Good health does not start from specialists like myself. So I don't know if I've said too much, but I really, really want you to perhaps think seriously if you are, thinking about contributing to the well-being of everyone. Think seriously about this program. And over the last few years, we've had a number of very, very good students, graduates, okay? And over the last few years, I see the map here. We have actually managed to also partner with multiple international collaborators to help look after our students. And over the years, we see the quality of the students who join us and during the program improving. So there will be a bright future for people interested in global health.